And of our time today, we hope you feel more comfortable and confident about the long-haul COVID-19 symptoms. And now, I would like to welcome our speaker today. Welcome, Dr. Francis. We are so glad you could be here today to share with us. And now is your time.
Thank you for the kind introduction. By the way, I again would like to introduce myself. I'm Dr. Francis Soriano from MyDoc Philippines, who happens to be the Clinical Director of Operations. And with me is Miss Pong Nguyen, who represents Vietnam, MyDoc. I'm currently also working as a doctor for certain companies, one particular in handling like 600 employees. So I know a little bit probably with COVID-19. So let me see the first slide, please. So this is just a quote from Miss Vivian Green. It says, "Life isn't about waiting for the storm to pass, but it's about learning how to dance in the rain." You know, I know I've been hearing about Vietnam having like probably 200,000 a day infections. Don't you worry about that, because you know the medical community all around the world are still finding ways to cope up on how to address this illness, and probably and how to dance in the rain, you know, meaning we're trying to find ways, the best way that could address, especially with the post-COVID, the long haul, the one that is mentioned by Ms. Lin. So we go ahead to the next slide. So what is the long haul COVID-19 syndrome? Or LHCS. So basically, the long-haul COVID-19 syndrome is, you know, you have this prolonged malaise, which means you have body ache all over. You could have headaches. You have generalized fatigue, sleep difficulties. You could even have hair loss, smell disorder, decreased appetite, painful joints. You have dyspnea. It meaning to say shortness of breath. You know, you have a difficulty of breathing. You have chest pain and cognitive dysfunction. This cognitive dysfunction is somehow what you call as brain fog. You know, something that you could somehow whenever you do things, you experience like blank stare, something like that. All of this happened after you contracted COVID-19. So this may persist like months. So next slide, please. So again, up to 80% of patients experience prolonged illness. Some say could even take longer. But it is not only seen after the COVID infection, but this one, it is being observed in some people that those who have received vaccines, likely because they have this monocyte microglia activation by spike protein. Is somewhat this is related with the interaction in the cellular level. So this LHCS may persist for months, like I've said, after the acute infection, and almost half of the patients report reduced quality of life. So patients may suffer prolonged neuropsychological symptoms, including multiple domains of cognition, or this is somewhat related to thinking. So a puzzling feature of this syndrome is not, you know, predicted by initial disease severity. It frequently affects mild to moderate cases, and younger adults did not require respiratory support or intensive care. So in this statement, usually post-COVID-19, it only gives you mild to moderate, not severe. So don't you worry about this. Somehow it may happen after post-COVID, but it doesn't really. It's just that you experience symptoms after you contracted it. Next slide, please. So again, symptomatology of LHCS. So here it is somewhat similar to a disease known as chronic inflammatory response syndrome, or CIRS, or other than that, myalgic or muscular encephalomyelitis, or chronic fatigue syndrome. If you experience like a fatigue-like, or you feel like you are tired, is somewhat similar with LHCS. So in order to differentiate from CIRS, you need to, continue to improve it in its own, albeit slowly, majority of cases. So this affects older people or persons with comorbidities, meaning to say, these have patients with other disease like hypertension, like diabetes, and so on and so forth. So if you add like, if you have like LHCS, it could mean that patients may present with other forms of illnesses. And for this fourth point, we have this mast cell activation syndrome, which has been observed and many consider to be a variant of the same syndrome. Next slide. So the LHC, the long haul COVID-19 syndrome, is highly heterogeneous and likely result from a variety of pathogenic mechanisms. It is also stated that a delayed treatment with medications in the early symptomatic phase, those patients who did not have treatment will have a high viral load, which increase the risk and severity of the long haul COVID syndrome. Next slide. This is one to show you again how we have a symptomatology of LHCS. It only shows here if you are suspecting of LHCS, with regards to respiratory, we have shortness of breath, congestion, and cough, persistent cough. We also have neurological or psychiatric, which I already stated earlier, the brain fog, the malaise means body weakness, tiredness, headaches, migraines, depression, inability to focus, concentrate, altered cognition, insomnia, vertigo, panic attacks, tinnitus. Tinnitus is meaning this is the ringing of the ears, tinnitus. And anosmia means you loss of smell, and phantom smell, you smell differently, phantom smell. So musculoskeletal, myalgia, meaning pain in the muscle. You have fatigue, weakness, joint pains, inability to exercise, post-exertional malaise, inability to perform normal activities of daily life. Hello? Sorry about that. Ms. Lynn?
Sorry, I have some internet connection.
Okay, okay. That's okay. That's
I am
okay.
sharing my screen again.
Yeah.
My screen.
Okay, good. It happens during the course of the seminar. Don't you worry. Anyway, can you forward next slide, please? So the question should be after this. Go ahead. Next slide. Slide number 10. Okay, that's one. So with regards to cardiovascular, which is the heart, we have palpitations, arrhythmias, Raynaud-like syndrome, hypotension, meaning the blood pressure is low, and tachycardia, meaning you have a high heart rate on exertion. Okay, next slide, please. And next slide. Okay, that one. Thank you, Miss Lynn. Autonomic postural tachycardia syndrome, abnormal sweating. We have GI disturbance, anorexia, diarrhea, bloating, vomiting, nausea. Almost all you could imagine. Dermatologic, you have itching, you have rashes, dermatographia, mucous membranes, you have runny nose, sneezing, burning, and itchy eyes. Okay. Next slide. So this one, theories postulated to explain the long haul COVID syndrome. So basically, you know, the COVID-19 is quite new per se. It's only started like 2019, I think, late December. So basically, the doctors have only come up with several theories, and these are the ones that I've researched into. And one particular theory is the ongoing respiratory symptom, which is the SOB, which is means shortness of breath, cough, reduced effort tolerance, may be related to unresolved organizing pneumonia. So these are like activated pulmonary macrophages. Macrophages is something like in a microscope. You could see that these are the ones who actually are helping out in an infection. So once these are pulmonary macrophages are a lot, they actually help out destroying the foreign invader, so to speak. So this is just one of them. And number two following theory is the monocyte microglia activation. There's a persistence of viral debris or the spike protein, which in monocytes and microglia results in an ongoing inflammatory response in an attempt by the immune system to clear the offending protein and viral RNA fragments. We all know that in the course of the vaccination, this is one of the areas that the vaccine is helping out trying to clear or rather making antibodies from a RNA level to produce in order to sustain you know, in order to have our immune system boosted. So the problem is sometimes a little bit of if you have like a lot of antibodies, it will create some kind of you know, it backfires. So somehow this is one of the reasons why you still experience LHS. Next slide, please. And another one is a neurological symptom may be related to micro and or macrovascular thrombotic disease, which appears to be common in severe COVID-19. So in a brain MRI 3-month post-infection demonstrated microstructural changes in about 55% of patients. So there are features of encephalopathy. This is involving the brain, which is related to encephalitis, inflammation, the meninges, and autoreactive brain antibodies, as well as severe cerebral vasoconstriction. The brain microvasculature expresses ACE2 receptors, and SARS-CoV-2 pseudovariants may bind to the microvascular endothelium, causing cerebral microvascular inflammation and clotting. Next slide, Ms. Lin. Any questions so far? This one, okay. Thank you. So the fourth theory is the mast cell activation syndrome, MCAS, or triggering of mast cell activation syndrome. These are the mast cells which are present in the brain, especially in the median eminence of the hypothalamus. I'm sorry for the medical terms, but they are located perivascularly close to nerve endings, positive for corticotropin releasing hormone. It's something to do with hormones. Okay, we go ahead with if it is stimulated, it releases pro-inflammatory mediators such as histamine, tryptase, chemokines, cytokines. When these things happen, this could create a neurovascular inflammation. A little, what I'm saying is more than you need would also cause problems, So the brain fog, cognitive impairment, and general fatigue reported in long COVID may be due to mast cell-related neurovascular inflammation. So this is a much more practical part, approach to treatment. Here, I can point out what to do during the course, If having symptoms, like I've said earlier, I could state some medications that are being prescribed currently by doctors, and also the things that you could, medications that you could actually use at home. So before that, the treatment approach should be individualized according to the grouping of clinical signs and symptoms. It is likely that patients who did not receive adequate antiviral treatment, I included this one. It is very, in some parts of the world, ivermectin is not being used, but it is used in Japan, India, in the Philippines, and some parts. But I respect the government authorities to not include that, but due to the basis of the lack of what do you call this, clinical trials. So in this case, for the sake of this seminar, we'll just include that. But what I implying is the patients who did not receive adequate antiviral treatment during the acute asymptomatic phase, during the early phase, would result to LHES. We could actually have this therapy. We also have adequate anti-inflammatory macrophage repolarization therapy, which includes steroids, statins, omega-3 fatty acids, like in the one the usually fish oil, fluvoxamine, during the acute phase of 19 are much more likely to develop post-COVID-19 syndrome. In patients with ongoing respiratory symptoms, we have chest and first, if you have like this, you could actually go to your doctor and ask for chest imaging, CT or preferably CT scan, just to have like a confirmatory. It's not mandatory, but you could suggest to your family doctor. Secondly, if you have like a pulmonary inflammation, an organizing pneumonia with ground glass opacification, they usually give steroids. One of the steroids are low-dose prednisolone methylprednisolone for 6 weeks is usually suggested. Next slide, please. And those with symptoms with C-reactive protein should be followed as a dose escalation. An unknown number of patients who have recovered from COVID-19 will develop pulmonary fibrosis with associated limitation of activity. Sad to say, some of my colleagues here who happens to contracted COVID-19, though he was healthy before, developed this one, the pulmonary fibrosis. His lungs shrunk, so to speak. But this is just one of many, one of many symptoms that a long haul COVID syndrome happens. So in order to do that, if you have like a problem regarding pulmonary with regards to shortness of breath, we usually give pulmonary function testing, and if it demonstrates a restrictive type pattern, the one that if ever you inhale in such a way, you inhale it at its maximum, but still you feel like you're still not breathing well, that's a restrictive type. So this one, residual volume, the DLCO, is one of the tests to test if it is restrictive or not. All of this, of course, can be asked through or referred to a pulmonologist to better address the problem. Next slide. So we have the antifibrotic therapy. We have these have a role in the patients. We have the serotonin receptor blockers, cyproheptadine, which reduce the risk for pulmonary fibrosis. We have this one, the whenever the patients have recovered from a septic shock, in theory, a prolonged immune disturbance with elevated pro and anti-inflammatory cytokines may contribute to the LHCS, like the consequence of monocyte activation syndrome and monocyte repolarization therapy, whenever indicated. Next slide. So activated microglia may contribute. A cytokine panel, this is one of those, I think this is the one that is currently being used now. You have to have a cytokine panel in order to know if there is an elevation. If there is an elevation, this one, the Maraviroc, is currently used in major countries like US, Singapore, where if it is with high CCR 5 levels. And part of the approach also to treatment is omega-3 fatty acids. The steroids have been demonstrated to increase in expression pro-resolving lipids, including protectin D1 and resolving D4. Next slide. Naltrexone. I'm not sure in Vietnam if they already use opioid medications. Naltrexone is an opioid antagonist. In our country, it's considered a regulated drug because of its opiate, possible chronic opiate abuse. But this one, naltrexone, if it's given at low dose to about 1 to 5, demonstrated an anti-inflammatory and analgesic. Analgesic meaning for pain. It's very useful for anti-pain and neuromodulating properties. Somehow this is related to having a good immune response in the neurological sector, like the brain functions and the nerves. So LDN, or the low dose naltrexone, reduce glial inflammatory response by modulating toll-like receptor 4 signaling, in addition to systematically upregulating upregulating endogenous opioid signaling by transient opioid receptor blockade. Okay, so LDN so far has been still new, so to speak, but it is successfully useful in fibromyalgia, Crohn's disease, multiple sclerosis, complex pain syndromes. LDN has been useful in as it inhibits activated macrophages, monocyte microglia. So microglia produce inflammatory and excitatory factors that can cause sickness behaviors such as pain sensitivity, fatigue, cognitive disruption, sleep disorders, mood disorders, and general malaise. The clinical features typical of those found with LHCS. Next slide. Yeah. So here is the management protocol for long haul COVID-19 syndrome. Go ahead, please. Like I've said, the lack of clinical treatment trials of long haul COVID-19 syndrome, these recommendations are based on the pathophysiologic mechanisms of COVID-19 and post-viral illnesses, along with the medical society, the collective experience observing profound and sustained clinical responses achieved with the treatment approaches below. So these are protocols being used to treat post-vaccine inflammatory symptoms with similar success. And usually the components, doses, and durations will evolve as more clinical data accumulates. If the patient presents with shortness of breath or low oxygen levels, refer to lung specialists. You know, I would have recommended to usually at home here in the Philippines, I give them what do you call this, pulse oximeter. If you have pulse oximeter, you can actually buy it in the pharmacy and check for your oxygen level. So this is the one that you put in the index finger, and you could actually have a reading. So if there's a low oxygen level, then you may go to your own doctor or a lung specialist, and then you have a chest imaging or to assess for second if there is any problem further. So if there is a consistent like a pneumonia, well, you can actually go to your doctor again and have like a course of treatment in order for the oxygen levels be addressed. Next slide. Here, for the first line therapies, we have ivermectin, we have prednisone, and naltrexone. Okay, usually the doctors will prescribe this, so you don't have to worry. If the first line therapy is not effective, then you go to the second one. So we have second and third. Next slide. Yeah. This is still first line therapies, the omega-3 fatty acids. This is very good. And vitamin D. This is somehow I will try to promote. This is not prescribed or a medication that needs prescription. You can actually buy it, but it really depends on how many international units vitamin D has. So majority, it is found out that those with post-COVID-19 syndrome continue to have hypovitaminosis D. So meaning to say, if you have hypo, you are low than normal. That's what it means. So can we see the table, please? The next slide. Yeah, this is one way of seeing if you have like how do how do you measure your weight? Is it in kilograms or in pounds? So if it is in kilograms, this is a good table that you could actually look at. So if ever you have like a, let's say I am like 90, so I'm quite heavy, 90 kilograms. So I mean in this BMI 20 to 29, non-obese, you have a daily dose of 5 to 7,000 IU per day. So this is something new. There are doctors who are actually promoting that, because it's sometimes that, you know, for us in the Philippines, if ever, you know, when these things, COVID-19 happen, we are in lockdown for like 2 years. So most of us are quite, there are no sun exposure, and actually we need that, you know. So in order to supplement that, some doctors tried to give through supplementation. And one of the supplementation, you could actually buy it. I'm not sure in Vietnam, but in pharmacies here, you can actually buy, but it's quite limited, not that high. Actually, we have medication like only 1,000 IU. But here, but some like US based like Kirkland, someone, they actually give like 20,000 IU, or even lower, 20, 10,000, 5,000. So look, maybe you could look for that. Okay. So next slide, please. So these are like, if the first line therapies won't help, then we have fluvoxamine and atorvastatin. You would notice that in atorvastatin, this is the one that is being used for cholesterol. But in this case, we have some post-COVID-19 patients have postural orthostatic tachycardia syndrome. So this is something that you need to avoid. If you are using atorvastatin, this one you avoid using. Next slide. Yeah, I already mentioned about Maraviroc. This one, it's quite expensive because it's a relative new drug. But I guess if the doctors would be the one who will decide if it's good for you or not. Not only in in terms of expense too. Next slide. This is very interesting. This is like optional adjunctive therapies. This has had been, curcumin. This is actually a relative of ginger or turmeric. So this is quite good. I'm a fan of those of this because it's like it's a fruit supplement also, but has anti-inflammatory, immunomodulating properties, and demonstrated like repolarized macrophages. And also we have Nigella sativa, which is like a black beans or black cumin, I think. So like the curcumin, it has anti-inflammatory and immunomodulating properties. This curcumin and Nigella sativa are part of the what you call as much longer than you think, took like thousands of years, part of the Ayurvedic medicine. So this one I also I think could help. If it helps, then go for it. Then vitamin C, of course, it inhibits histamine and repolarizes monocytes. Next slide. Other is a melatonin. Melatonin somehow makes you. This is used in order for you to sleep, because some of the patients have problems with insomnia. Insomnia is one of those symptoms that a patient experiences having post-COVID-19. Also, kefir. Kefir is a probiotic yogurt. Bifidobacterium probiotics and prebiotics normalize the gastrointestinal flora. So we have also, again, this is the non-medication. And hopefully, with regards to psychological counseling, you could ask for this behavioral modification, mindfulness therapy, and psychological support. This would definitely improve the the overall well-being and mental health. Next slide. This is not much familiar, but it is included anyway. Luteolin and quercetin, which I believe are both also food supplements. We have broad spectrum anti-inflammatory properties. These natural flavonoids inhibit mast cells and have been demonstrated to reduce neuroinflammation. And we also have like H1 receptor blockers, H2 receptor blockers. That could be lower down the mast cell activation syndrome. Okay, next slide. We have the Montelukast. Montelukast is one of the medication in those having like asthma. But this one, Montelukast, it's like how can I explain this? If you have like allergies in somehow in post-COVID-19, these medications lower down the one that causes allergies. Okay, so I think this slide from Jonas Salk, the mind in addition to medicine has powers to immune the system around. So what I'm trying to imply on this thing is that, you know, COVID-19 is creating a lot of havoc with patients mentally. What we really need is that, you know, just stay positive. We could actually beat this. You know, I'm also angry in a way because it has been taking a lot of toll. So what can we do at this point? But slowly and surely we are trying to defeat this illness, and it's a good thing that a lot of the way I think grow in a global scale, the people around are very cooperative in dealing with this illness, and the medical community is very happy that, you know, if there is a chance to take the vaccine or to take the medication, do the normal thing as normal as possible, then we could everything will work, so to speak. So for that, I thank you. I'm now open for questioning. Thank you, Miss Lynn, for helping out.
Okay, thank you, Dr. Francis. Thank you for your very informative sharing. So now to the Q&A section. Got some question.
Okay.
Yeah. So, could you please answer that? How can I recover my smell sense?
Pardon me.
The question number one, could you please answer that? How I can recover my smell sense?
A smell sense. Oh,
Yes.
okay. You know, from my experience here in the Philippines, the smell sense, if someone actually had loss of smell, it will recover on its own, but it will take like maybe more than 2 weeks, at least 2 weeks, maybe 2 weeks. Just take the usuals, the vitamin C, vitamin D, D3, zinc. Just don't forget that we have this the usual 8-8. You have to take 8 glasses of water a day, 8 hours of sleep, and that's loss of sense of smell will recover eventually. But I believe that it is really frustrating because you cannot smell. Sometimes some patients would loss of taste. They could not taste for like 2 weeks or so. But eventually it will. They will recover. So don't you worry. There is no, at this point, there is no really what do you call this? The medication per se that would bring back the smell or the taste. It will recover, but anyway, without medication. That's it.
Thank you. Like, since you are mentioning like some kind of supplement, so we have a question here. Like using like collagen, glucosamine, or vitamin C as supplement every day. So is there any kind of medicine in your list that we should avoid?
That we should avoid?
Yes.
What medicine?
Because she is using some kind of supplement such as like
a supplement.
Yeah.
Okay.
Or vitamin C or glucosamine. So should we is there any kind of medicine in your list that we should avoid?
Avoid? You mean not taking it?
Yes.
Well, it's the other way around. I'm the kind of doctor who actually would ask if the supplements are doing okay or not. So, for example, I'm a proponent of vitamin D3. So in my many years of having to read special articles, vitamin D3 is somehow we needed the most, because it's somehow there's a story about vitamin C. Did you hear about that? The seaman who goes into a journey way in 1800s, 1700s has suffered from scurvy, but it's a vitamin C deficiency. So what's the best thing to do? You just have to take vitamin C or eat lots of citrus-based fruits. The same likewise in vitamin D, it has been found out that in their blood, their post-COVID, or rather those who didn't have any vitamin in any illness, they found out that vitamin D is low. So we need to have like supplementation. So one way is to have this patient undergo sunlight like at least 8 minutes a day, or you have to take supplement. For glucosamine, this one, I think this one used for, I'm not sure. This is okay, I think. And nothing to avoid, I think, at this point, unless you mention another one. So okay, go ahead.
Okay, so since you said that vitamin D is we need 10 minutes a day in under the sunlight, right?
In the sun, yeah.
Yeah. So but
but
yes.
it really depends on the time of the day, because some some of the ladies here don't want to get having sun at the middle, because the skin will burn. So some they would have like sunlight exposure like in the morning, early morning, or towards the sunset, because it's much more. But anyway, what is really important is the UV rays, which create the magic, the whole magic of transforming. Vitamin D is actually a hormone that is produced by the body only by God's design, and that is by way of the sun. I could not explain it further, but this is how it goes so far.
Like I think like the vitamin D is kind of easy to take in Vietnam because we have we're the tropical countries where we can enjoy light every day. Okay.
I see. Yeah, I actually visited Vietnam in 2019 before the pandemic in Ho Chi Minh. It's a very beautiful country. And we went like to 10 days only. Still, we like it more, but have to say, I have to go home.
Okay. We're moving to the next question. Yeah. We have a question. I have infected COVID-19 3 weeks ago and recovered, but sometimes I feel breathless. So should I keep running every day with short distance, or I need to change to another kind of sport?
That's a good question.
Yeah.
You just have to, I guess, challenge yourself every day. I guess if you are like running like 10 kilometers. No, 5 kilometers, for example, 5 kilometers, and it makes you a little bit tired. You can reduce it. You can reduce it further or take a half. Then probably after, let's say after 6 months, you could actually adjust, but don't strain yourself. What is really important, I would really advise to have your, keep on doing things the way it is. Like if you are a walker, you keep on walking, because here I realize, you're looking at me. I was thinner in 2 years ago because of the lockdown. I had to stay here, and that created a lot other problems. Like for example, now I feel like having shortness of breath after a few meters only, because I lack exercise. So what I'm trying to say is, for me, what you are doing is okay, provided that if you feel like you have like of course, definitely by exertion you need to tone down, but you could improve later on. You could improve step by step, not the you go before I go 5 kilometers, then I go 5 kilometers ahead. No, no, you could reduce it. You could reduce, then you start again, getting those highs, those goals. I really recommend walking like 6,000, 8,000 steps a day. That's good actually to maintain the flow of the blood. It's like a car. If you keep if it's not if you park it, in Vietnam you have lots of motorcycles, right? So if you are not using your motorcycle, if you don't use it, it won't start. So the same as our body also, you need to keep it up. I hope that answers.
Okay. We have another question. So, hello doctor, I am infected with COVID and having a cough. So, can I ask if the cough is caused by a virus that damages your throat, or is it attacked by a second bacterium that causes inflammation? Should I use more antibiotics to kill the bacteria because I used to often have sore throats and take antibiotics to cure the disease.
Okay. The problem about let me answer that in a more general platform. If this is somehow causes you fever way beyond, like for example, if you continue having like problems coughing, then you have fever, probably that is bacterial. If you encounter pain in the throat down, including your lung area, chest area, that is bacteria. Because in the problem with, if going back to the COVID-19 per se is not really the problem. The only problem is when your body continues to, your immune system goes down, and secondarily the bacteria would incur, it will come. It's an opportunist. It will go into your body, then that will cause great problem. One second thing is that if you have COVID, it creates some kind of an allergy. It's like an asthma. So it has been shown that there is, I mentioned about the mast cell. If this mast cell increases, the allergy also increases. It creates some kind of inflammation. You cannot breathe. So if the immune system is not good, the bacteria, the opportunist bacteria will also come. Then that creates the complication of it all. That created with what you call pneumonia. So I hope that, you could actually, what we are trying to do right now is that we empower the patients in such a way that they have devices, simple device like blood pressure apparatus, the thermometer, the one you check for the temperature. Because if ever you could actually assess if it is high, usually you could actually assess if it is bacterial or not. Or if ever there will be like what do you call this, the pulse oximeter, the one oxygen. I'm sorry, I don't have the device, but you could look into it in the Google. This one you could actually see the oxygen level. If the oxygen level is below 90, you could outright say that you have problem in respiratory. We could suspect that it's a COVID-19, but it's not entirely, we could ask other aspects of illness. So I think with regards to your question, that one, I would say it's bacterial.
Okay, I think we can move to another topic, which is like vaccination. So, what's your opinion about the vaccines for the small children? Because the symptoms of COVID-19 for the children is not really serious, but most parents are really worried about the long-term unknown risk of the vaccine. So, you share your opinion about this.
Yeah, right now I could not have any. I'm very vigilant as a doctor to know more about these things. The vaccine, what these are the symptoms that happen after vaccination, right? So we are in continuous looking out for our patients, try to monitor as much as we can, and make the recommendations whether or not these vaccines work or not. But at this point, we cannot yet make a decision, at least in our country, because in our country, most are in favor of vaccination, like probably 60%. But some of us are quite actually hesitant, But what we can reassure as doctors is that the treatment modalities is there, of course, the vaccine, the medication, and whatever that would help the patient, then we go for that. But as long as we don't have a profound evidence of causing vaccine causing certain morbidities, then we will stay. I will like to assume that the government or the Ministry of Health of Vietnam are in total control. I would say they know what they are doing, and I think it's very admirable, I think, because Vietnam is #1, I think, in vaccine, if I'm not mistaken. In our country, we are facing like resistance. So, but what is really important anyway, at the end of the day, is that health is our concern, and we are trying to learn more about this new novel disease. They call it novel because it's new, simply because it's new. So we're trying to learn more about these things, and hopefully in the coming 1 or 2 years, we could come up with a better recommendation for the people, including, of course, in your country, we have the ASEAN. We will be definitely be talking about this in more years to come. So I think that's my answer for the question.
Okay, so but like, do you think that if a kid that they suffer from the COVID-19, so should they skip the vaccine, or should they still?
If I may have my kid, that's a controversial question. I'm not sure, but no, I have a kid, a 13-year-old kid. I would defer for now, but my mind is not closed for a lot of things, but I'm also open to a lot of new information. And for now, what is important for the patient itself, or rather the client or something, that they are informed. They are informed. So if the doctor doesn't really talk about this and that, then you must question. Also. Continue questioning.
Okay. Yeah, I think it's really controversial. Like, it depends on each person and their emotions.
Yeah.
Yeah.
But personally,
yeah.
my kid is not yet vaccine at the moment. But I try to, it's just wrong. I had my own reason. But as a doctor, it's a different thing. But I let the patient decide. In order to, it's like a restaurant. You give all the menu, let the one take its order. But making it, it's controversial.
Okay.
You know what I mean?
Yeah. Okay. So as you have, so we're back to the LHCH. So you have mentioned that, like, we have some kind of a disease like can overcome with the medical treatment, and need the medical treatment. So how bad is the side effect of the CS, and can you like list some kind of syndrome that can overcome without the medical treatment, like such as a smell sense that you mentioned before?
Mhm.
Yeah, and about some kind of disease which related to neuro or the brain. How bad is it? How bad is the side effect of the COVID-19 during the recovery?
Okay, let me rephrase that. You mean to say you're asking about medications
Yeah,
that could help post COVID-19?
yeah.
I
No,
don't
like
think so.
I am asking like which LSCS need the medical treatment and which is not need the medical treatment.
Okay.
Yeah.
I just okay, just to for the audience, for the ones who are now here, I'll just make it practical. If you encounter like these kinds of illnesses, if it's like urgent, go to the hospital. But if it's not, one particular for me that really strikes me is vitamin D3, vitamin C, and zinc. I forgot to include that, zinc. The other ones is just the ones that I mentioned, other that what I've said, vitamin C, vitamin D, zinc. Those are, if you have like continuous symptoms. For example, if you continue to have like shortness of breath or difficulty of breathing, then go to your doctor to have it assessed. The usual, the pulmonologist would see to it you are achieving they have this test, respiratory test that could assess if you're really have problems with your lungs. Secondly, I believe that there has been I think I'm not sure in Vietnam. In the Philippines, we have like an increase of mental health problems, fear of the disease because of how media works. Somehow, instead of helping out, they put images on the news, and somehow that don't help. This created some kind of problem with those people who are in lockdowns, especially for us. We are locked down into 2 years. That's quite a long time. And some of the reasons, actually, some of the admissions are uh, self injury. So they fear that they have already the COVID, which is not. So I mean, somehow what I see is there is a need for counseling to be upgraded in our country. I'm not sure in your country, but this is one of the areas that we need to see. But other than that, it's really bad to say that those who have already died in COVID-19 are those persons with comorbid conditions. It's like, if you have like COVID, your immune system goes down. So if you have like hypertension, it further goes down. Diabetes, it further goes down. So your survival is much lower. So if you are like if you are kid, if you are in middle age, 20-year-old, 30-year-old, 40-year-old, it's likely that you're going to survive. You just have to overcome it, so to speak. So I think that's from me. Overall, you have a lot. You have a lot. In Vietnam, you have a lot, like 200,000 per day, right? What is really important is you overcome it. Overcome. Don't let it get into you. Like somehow the mind really, the beauty is that you have an immune system that you can actually you can deal with it, you know. So if you overcome the illness, if you overcome the COVID-19, then definitely you have soldiers already in your body. You develop it naturally. So that's how I see it. And I'm not sure if the pharmaceuticals are going for the booster. They are going to give. They are still giving. But for me, a personal doctor, I'm not. I'm for the numbers. They have to give out studies so that we could actually inform our dear patients more, so that we can inform them. That's it.
Okay, thank you. Thank you for your sharing. Like me, I myself experience suffer from the COVID-19 already, and sometimes I have some kind of like shock, out of breath. But I think like that's because of me, like because I didn't do enough exercise. So like I'm not sure if it's the long haul syndrome or that's because of me. So I think like we should all build up our immune system.
That if you have like that, probably we need to understand also that probably lack of you know, the way I see it, if just look at the Okinawans in Japan, how they live like 100. There are many centenarians, 100 years old and above. They keep on walking, they keep on eating, but not full. They keep on eating like pork, and they have like a happy disposition. They keep on talking to people. They just do normally as they can. So what happened in lockdown is different. Lockdown, you stay at home, you just play games, play the computer, no exercise. So that's another problem later on. For me, I did overweight, you know. So, you know, having this problem, going the stairs became difficult. So the way I see it, you need to go outside more. If there's a chance, if there's no lockdown, then go play sport. No, better it is. Better than eating medication, for that matter. You know, medication are there to support, not to be the one that you going to take the rest of your life. You know, I don't support that, even myself, you know. But hypertension, of course, those hypertension you need to take. But those normally, as possible, you do the normal things, you know. I call it the eight game. 8 glasses of water a day, 8 minutes of the sun, 8 hours of sleep, something like that. So you don't have to forget it. You just have to do all these things. I think the natural way. Therefore, that makes our life easier if you know, if you are healthy, so to speak. But no money for us. That's the joke.
Yeah, okay. So I think like that's all we got today. So the point is we need to take good care of ourselves, like live healthy and eat healthy, do
Yes.
exercise, and like check our health regularly.
Yeah.
Yeah. So yeah, I think that's all we got today. So thank you.
You. I
Francis.
hope. Thank you for all the questions that you've thrown at me. I know you have a lot of questions, but sincerely, thank you from the bottom of my heart and from my country. We wish you the best. And all of your problems, don't you worry. You just have to overcome the illness for COVID. It's just a name. It's so we had a lot of illness. We have 3,000 kinds of illness. So you don't have to mention all the time, every day, COVID, COVID, COVID. You know, somehow you need to change the mindset and live your life the way the best possible you know how. So that's it.
Yeah. Okay. Thank you, Dr. Francis, for your time today. And thank you for joining us. We appreciate that you sign in and hope you find this section informative. If you have any concern, please reach out to us via the email, or if you need information.
Of course. Thank you.
Yeah.
Thank you, Miss Lynn.
Okay. We'll see you next time. Thank you.
Thank you, Mercer Mars. Thank you. Yeah. Okay.